Today is August the 12th. It's the Employee Benefits Insurance Committee meeting. Start time is 1:03 p.m. Linda McGinnis, can you do the roll call, please?
Linda's muted.
Amanda Cox is having trouble logging in. She's trying to log in.
Oh, okay. You want me to start again? And I'll just go back to Amanda. Okay, so Barry Best is here.
Here.
Okay, Caroline Sudlow.
Here.
Okay, Dwight Vandevet.
Here.
J. Michael Pessier.
Here.
Casey Stone is not going to be here. Lisa Gerald.
Here.
Linda McGinnis, I'm here. Carter Pack. Michelle.
I'm here.
Yeah. Michelle Carringer is not here. Nikki Davis.
Here.
Randall Kenner.
Here.
Samantha Chittum.
Here.
And William Buddy Bookhart.
Here.
Okay. And we do have a quorum.
Thank you, Linda.
Uh-huh.
The second thing on the agenda, the approval of the February 2020 Insurance Benefits Committee meeting minutes. Did everybody get a copy of those? Anybody have any questions, concerns, changes? Do we have a motion to approve?
So moved.
Who was
Second.
that?
Yeah, who was that? Who said that?
Michael.
Michael? Okay.
And I seconded Linda. Caroline Sudlow.
Caroline? Okay.
All in favor?
Aye.
Aye.
Any opposed?
Aye.
Excuse me, the rule on these Zoom meetings is you have to have a roll call vote on everything you vote on. So
Thank you, David.
it's burdensome, but that's what the says.
Okay, Linda. We're voting on the agenda item number 2, the approval of the committee meeting minutes from February of 2020. If you want to do a roll call vote.
Okay. Amanda Cox. Okay. Do I have to mention the people who are not members or not here that I know are not here, David?
No, just call whoever's here, call their names out so they can vote yea or nay.
Okay. Barry Best.
Here, yes.
Okay. Caroline Sudlow.
Aye.
Dwight Vandevet.
Aye.
J. Michael Pessier.
I made the
Aye.
motion. I made
Oh.
the motion.
Okay. Lisa Gerald.
Aye.
Linda McGinnis. Aye. Carter Pack.
Aye.
Nikki Davis.
Aye.
Randall Kenner. Samantha Chittum.
Aye.
And William Buddy Bookhart. Okay. Okay. 6, 7, 8, 9, 10, 11. That's 11.
So there's no no. So David, are we good on that? That passes.
Yeah, she just record, they're on here and this is recorded. So all the yeas and nays are there, but it passes 11-0.
Okay.
Okay. Thank
And
you,
that's what the
David.
minutes would reflect, 11-0 on the vote.
Okay.
Sorry about that, but it's a
No,
county
we're
committee to do all that.
learning. The next item on the agenda, Stephanie Candler is the new benefits director. She is going to talk to us about the benefits department leadership change. So Stephanie, it's all yours.
All right, thanks, Samantha. Can everyone hear me all right?
Yes.
Okay, good. So as you know, I'm Krista Baig's replacement as the benefits director. This item was added to just give you a little background on myself and what led me to this role. Since some of you don't know me, I've had the pleasure of working with some already, but I figured I'd introduce myself a little more formally than the email that we sent out previously. So I'll jump in just to get us through this, but I'm a graduate of the University of South Dakota with a Master's of Business in Health Services Administration. I've been with the county for a little over 4 years now. I spent 3 years at the health department in administration, and then I've been in benefits now for a little over a year. At the health department, I was involved in almost everything you can think of in administration, but specifically workforce development, staff education and recognition, committees and wellness initiatives. I managed our intern program and then eventually became the human resources liaison for the department. I kind of outgrew my space there and applied for an opportunity here in benefits. And since I've been here, I have kind of been an understudy for Krista. I've been heavily involved with all of our department functions, restructuring and rebuilding of current processes and protocols, vendor management, quality improvement efforts, compliance and customer service oversight, and staffing needs and department initiatives and projects. So prior to Knox County, I spent a little over 18 years in the healthcare industry with experience in almost anything that didn't involve a medical license. So medical records, medical billing and coding, transcription for a large bulk of that while I pursued education and raised my daughter, clinic management and quality assurance. And my experience in education have given me a pretty extensive knowledge of current industry practices for medical and pharmacy, current and future industry challenges and reform efforts for medical and pharmacy, and strategic planning, operations management, and pharmaceutical regulation and pricing. So on a personal note, I grew up in the United States Air Force. My moral and work ethic reflect those experiences. I really enjoy serving our team members. I look forward to getting to know all of you better, and I'm really honored to fill this role for Knox County and to be a part of this team. So that's me in a nutshell.
Thank you, Stephanie. Linda, do you want to note that a few more people have joined? Amanda Cox, for sure. Is she the only other committee member that's joined? I believe so.
Okay.
Let's move to item number 4 on the agenda, the open enrollment plan. So I believe, Stephanie, you're going to talk about that too, right?
Yeah, you all are going to hear a lot from me today. It's pretty much the me show. So let me share my screen here really quick. I just wanted to update everyone since this year is a little different than normal on what our plans are. So everybody's on the same page and we can kind of work together to get through open enrollment this fall with the current COVID-19 situation. Can everyone see this all right?
Yes.
So enrollment dates are going to be October 19th to November 13th. Just a reminder, there are no biometrics forms due for the 2021 plan year. So spread the news. I think just about everybody knows, but every now and then I still get that question. So some people may still ask. There are no vendor changes for 2021 with the exception of maybe life insurance. It's currently still in process, so I can't really confirm, but that's one that's not really going to be impactful. And if it does, it's going to be a positive thing. So we're probably going to save a little bit of money on both the employee side and quite a bit of money on the employer side if things go well. Help sessions will not be held in person this year with COVID-19 concerns. The sessions get really crowded. Vendors are not able to travel, so we wouldn't have anyone here for vendor questions. But my staff and myself will still be readily available via email or phone. Just a reminder, email's the best way to receive an immediate response. We actively monitor that inbox between our normal business hours of 8 to 4:30. So one of the three of us will get back with you almost immediately, if not right away. Voicemails are addressed within one business day, typically sooner. It just depends on how much call volume we have at the time. And then we will make appointments. So we realize there are some people that just will still need our help, and we'll make appointments. We'll schedule those. We are going to require masks to be worn for any in-person appointments, and then we'll maintain social distancing and just set up our rooms so that we can keep those protocols in mind. And then we are creating a employee self-service benefits enrollment guide that's going to be like a picture tutorial, just basic, simple screenshots of ESS and sort of a point and click next steps to kind of help users through that. So I'm encouraging department managers and team leads who've done this for years to answer any basic enrollment questions and maybe point new people to where they should go. But any kind of benefits needs, you all are more than welcome to reach out to us. If your departments need specific or special accommodations, or you have specific requests, feel free to reach out and we'll do our best to adjust with the current situation. That's pretty much it for updates, unless anybody has any questions.
Stephanie, can you send that page to us via email when you have a chance?
Yes.
Okay.
And I have one question, Stephanie. With the employee self-service benefits enrollment guide, is that going to be separate from the regular benefits enrollment guide that we get? Or is it going to be rolled into that? How is that going to work?
Yeah, we're still going to have our usual benefits guide. This will be more of an employee self-service focus to show the actual process step by step from login to submitting benefits, and just a basic picture tutorial to kind of assist people. But I planned on sending it out with the guides, so you'll receive both.
Thank you.
Yeah, and we'll make it available on our website. It's something, you know, that people have talked about wanting anyway. So we figured with the current situation, we just go ahead and create one. And I plan on sending it out. I will most likely send it out ahead of time to this committee as well, if that's okay with everyone, and let you all review it and tell me if there's any missing links. I feel like things like that are better when they're reviewed by more than one set of eyes to make sure that you could actually use it and not have to ask any questions in between each step that we include.
And when do you think that will be forwarded to us?
I'm hoping no later than the end of this month. I'm shooting for next week. We're not graphic designers, so we're gonna do our best to make it look nice, but it'd be really nice if we had a graphic designer and we'd have it done already, but we're trying to make it really visually appealing and easy to read and easy to use, and also not 16 pages long. So I'm hoping to send that out next week, but end of the month latest, so we have time to print. Any other questions? Sorry.
Sorry, Stephanie. If no other questions, Stephanie, can you talk about the new prescription drug formulary changes that were effective July 1st, please?
Yes, let me share that one with you now.
That was item number 5 on the agenda.
Sorry, I had it open and then it was connected to another PDF, so I'm not seeing it in my share. Sorry, I am also not technically savvy when it comes to these meetings. Oh, there we go. Okay, so Optum provided this for us. They set the formulary. They do it at the beginning of the plan year, and then they have usually another one that comes out in July. So this is the July update. And Samantha had asked that we touch on this for the committee. It's really hard to look at the formulary and figure out what's different from the last year because it all looks the same when you just glance at it. So I asked Optum to give us a summary of what changes were made. And this is pretty much it, what they sent us. This was sent out to you all. Nothing major that I can tell from a disruption standpoint. We had some diabetes medications moved to a lower tier, which is a good thing. It makes them more affordable. So they've outlined these medications there. And then we have some that have moved to a higher tier. Mainly that happens when there are comparable medications available at a lower cost to just try and help steer members towards those lower cost medications. So those are listed in the next section. And then we have some exclusions, which always occurs with a formulary change. And it's typically also because there are alternate medications that either have a better clinical outcome or a lower cost. If any of these create severe disruption, of course, we can have conversations with Optum in trying to find some exceptions, but as far as I can tell, it's pretty standard changes and nothing major.
Does anyone have any questions on that? I just kind of wanted Stephanie to talk about it in case you all started getting any questions, because there might be a handful of people who saw it and would come to you all. Since you're on the committee, I feel like people would probably come to you to ask questions. So,
Hey, Stephanie, it's Michael. Does our plan have a step therapy option there where if somebody takes the alternate medication and it doesn't work for them, can they go back to the original medication that they were taking without the higher cost?
Yes, that is a good point, Michael. Thank you for bringing that up. They still have the same utilization management programs in place, which include step therapy. So a lot of times if people go through this route, and that's where we start to have conversations with Optum as well, and it doesn't work out for them, then there will be exceptions made. And the utilization management a lot of times is step therapy, quantity limits, and then prior authorizations. If it's excluded, it's typically excluded like the vitamins because there's an over-the-counter option or something else that's available that they prefer you try first.
Okay, thank you.
And there have been no changes to our utilization management plans with them. It just helps us to have a clinically based formulary that removes waste and promotes appropriate use. Sometimes doctors just prescribe whatever the latest medication they've heard of is. And honestly, it's been my experience, they don't typically know the cost. And so they'll prescribe something that's extremely expensive to the member as well as the plan. And there are alternatives. They just haven't used them or aren't aware that the cost is so high. And so typically when people go back and let their doctors know that, then they'll research and find them a different medication.
I just want to make sure they have some recourse because I know sometimes with different binders or whatever, certain medications don't work for certain people. And I hate to see them penalized for something like that.
Yeah, you're absolutely right. And there will still always be those exceptions made.
Thank you.
any other questions?
I had a question, not really a question, but One thing to notice on the handout that Stephanie gave us is the description of the tiers. Years ago, generics used to all be in tier 1, but they're not all in tier 1 anymore. If Stephanie could just explain a little bit about that.
Yeah, so unfortunately, when generics became cheaper, then pharmaceutical manufacturers found ways to continue to increase cost even on generics. And so what they typically will have is exclusivity rights or something where there's only one generic available. And until other manufacturers can start producing those same medications, then they typically are higher cost. And so the drug companies and manufacturers can actually make quite a bit of money off generics, and they do still. So the PBM managers are really good at identifying those and helping tier those out. So we're not just assuming that all generics are the cheapest option. But that's a good point, Lisa. Thank you.
Thank you.
Any other questions on this for Stephanie or no? Next item on the agenda, number 6, we need to vote on the 2021 health insurance premiums. Stephanie sent them out, and then I believe Linda sent them out to everybody on the committee. Does anyone not have those available to look at, or it looks like Stephanie's going to share them too, so.
Yeah, and I'll just touch really quick and then let you all discuss. I used the similar format to what Krista gave last year because it was a nice way to calculate the increased amounts if we did raise premiums. But I simplified it quite a bit to just show basically 3 options here: $2, $1, or no increase at all across all 3 tiers. I included some factors to consider on there on the front for you. And then the next 3 pages are just to show where I got those numbers from. But I did simplify those as well. There were percentages and things in there that I don't think really make a difference. And so hopefully this is self-explanatory. I don't want to influence the vote. You all are more than welcome to decide what you think is best for employees. I did include the factors to consider because I wanted you to have some insight into where our department stands financially and where our team members stand in the current COVID-19 situation and what we've seen as far as life events and job loss, and some feedback we've gotten from people on morale. And it's just been a rough year for a lot of people. And so I would personally recommend no increase this year, but there are also reasons for an increase, and it is hard to dial that back and then have an increase in future years, which we talked about last year. But we've had a lot of job loss. We didn't get raises this year. Our reserve funds are really stable, and we've eliminated quite a bit of waste in the plan. We had an actuary review our claims experience, our fees, our premiums and everything, and confirm that we're within 1% of our current budget. And on the flip side, there are some uncertainties still. We haven't seen an impact yet from COVID-19, but that's not to say we won't. And we have no idea what that's going to look like financially, at least. The good thing is, and partially why we're still going to save money on life insurance, a lot of people aren't impacted who are of working age. So it's a lot of our older folks that are medically impacted greatly with this virus. And so we're not seeing a lot with people that are currently of working age, which is one of the reasons that, you know, our life insurance proposals came back lower or better than we expected, because we thought no one would give us better life insurance pricing in a pandemic year, but it was actually quite the opposite. Because a lot of people didn't go out to bid. And so there are also general inflation and especially pharmacy costs. So I'll let you all discuss and decide, but there's two different schools of thoughts there.
I'd like to make a motion for choice D based on your information provided in your recommendation.
Was that Michael?
Yes.
I'll second that, Lisa Gerald.
And then is this where we have discussion before we vote? Anybody have any questions, concerns, thoughts, feedback?
I'm kind of concerned about not doing any increase. I understand the point in thinking about people who have not gotten raises and have had job losses. But I am concerned about what happens if we end up with a lot of COVID claims throughout the winter, which of course would go into the plan year for next year. I don't think it should be two. I think the $1 increase we did last year, is sufficient, but I just worry about not having some sort of cushion.
Well, do we know how much surplus we have?
It's not offhand. The reserve funds, the county budget itself is struggling. Of course, this year there's less money available, mostly because we just want to be conservative in our thoughts. So Caroline makes a really great point. There is enough, I'm confident to say that we could survive a year even with some higher claims, and we could reevaluate next year. You always have the situation where you give no increase and then you give one and then they revolt again too. So sometimes consistency is better with these sort of increases, but I can't give you an exact dollar amount, but I can tell you it's enough to get us through the next year without any problems.
Stephanie, I have a couple of quick questions. What was there a choice C? I see we've got A, B, and D. Was there a choice C?
Oh, I knew there would be a typo. I've looked at this thing.
Well, I just wondered if there was one.
Sorry. Yes, that's left over from last year. The choice C last year was it was where you increased some of the tiers $1 and then increased employee and spouse and then the family plan $2. And I cut that out and just didn't update the D. And I kept looking at this thing and saying, I know there's a typo on here and somebody's going to find it, and that's it. So my apologies.
That's fine. It's no problem. And then my second question was, if we were to see a drastic increase to Caroline's point, and I think it's a good one, if we were to see a drastic increase in claims that could be directly tied to COVID cases, would that give us would we find any relief in the CARES Act funding and the funding that's been provided by the state to local governments in response to the into the COVID pandemic?
That's a really good point. And I'm confident that's part of why I said I really don't think that we have too much to worry about as far as if we see an impact in claims. The people that are working age that are getting this virus are recovering. Thankfully, a larger amount of them are recovering. So even if we did get claims for this, for our group of people, it's not going to be that impactful that it would drain those funds or our reserve funds or get anywhere near that, even if half of our members were to have medical claims related to this virus.
Well, again, to Caroline's concern, and I certainly think it's valid. I do think we, as a committee and benefits as a department, we have to manage expectations. If we don't raise rates this year, our employee population needs to understand that there are reasons why they weren't raised, most of them financial, but that it is likely and probable that we will see an increase in future years, and discuss that, because what we don't know, again, to Caroline's point and to what the point you just made, with our employee population, we have a certain relative, we have a lot of data that tells us their age and all that stuff, but with their dependents, not so much. We don't, I mean, the committee doesn't know about dependents with comorbidities or spouses with other complications that could easily drive a claim through the roof to the stop loss point. But, I just think if we look at that CARES Act option and see if that is a possibility to safeguard us, should we have a boon in claims or a few large claims to safeguard what we've got.
Well, question again. Two questions actually, to the point of the CARES Act funding. It's well publicized in the news that there is, quite a lot of concern about the level of funding that was available under the CARES Act and what other funding might be available to state and local governments in future acts. And I'm not very familiar with how those funds under the original CARES Act are apportioned among municipalities within the state. But, West Tennessee and Middle Tennessee has been much more impacted by COVID than East Tennessee, but we've seen our numbers go up too. So, but we may be behind the curve. And so I'm concerned about planning for money that may or may not actually be there. Plus, there's the chance that the original COVID treatment is not the end of the problem for our employees. There's a lot of information coming out now that we can expect long-term health consequences to lungs, heart, kidneys from having had an adverse reaction to COVID. So we may be looking at increased claims based on far-reaching consequences. So again, I'm still concerned about not raising at least $1.
From another perspective, I guess, when I was in benefits, there were 3 years where we had no increase at all for the plan to anyone. And that next year when we had to make an increase, a lot of people complained and said, oh, you've increased every single year. And I'm like, well, there actually wasn't, an increase for 3 years. There is one now, unfortunately. So that kind of to what Caroline said too. If you don't want to increase right now where, and like Stephanie has in here, during all this right now, some people have lost jobs or have lost income, or down to one income. We didn't get raises, but I feel like that dollar, it's so minimal, but at least it's something to where next year they won't be like, well, you didn't raise it last year. Why are you raising it this year? Another concern would be, and Stephanie, I don't know if you can answer, do you know how many people, or if anyone has actually met their max out of pocket for the year or met their deductibles? We're still, we're a little over midway through the year. The end of the year is when a lot of our claims kind of start trickling up and getting higher, because a lot of those people do reach their max, plan years, and then it's all on the plan, not on the person. I don't know if you've got any of that information or anything like that to kind of help.
I mean, there are always some by this point in the year that have met that. You're absolutely right. The end of the year and the fall tends to be when claims are higher, just in general, because people have met their deductibles and they start going to the doctor. We haven't actually, I'm not quite sure. We're looking at the data now, but there may be less people who are going to the doctor this year as well because of the COVID situation. And that's something to think about. There was a period for 3 months where people were pretty much just doing telemedicine and not visiting hospitals unless they had to. And so we've kind of been following those trends as well and trying to see where visits to the doctor were this year as opposed to last year's and the years before. But that's a great point. And that's something I said before too. If you don't increase and then you do next year, people will say something, but like she said, they'll say it whether you increase or not. So it's just, and they'll blame us. So don't worry. It's fine. Either way, Caroline makes a great point. Samantha makes a great point. Everybody, Michael, you're making great points. I don't know that there's a right or wrong here. I can assure you, even without the CARES Act money, we could survive a year and reevaluate next year without an increase. But if we keep increasing, of course, we're gonna always use those funds to account for inflation and things like that. So it's not like it wouldn't be beneficial either way. It's just we have the possibility absolutely to be fine and still have plenty of reserves. It's one of the reasons we did the premium holiday. We were able to do that because the funding or the plan reserves were so stable and so high that we wanted to drain some of that down and give it back to the employees who contributed to that. But even with that, we're still in pretty good shape. So we could survive a year easily. If you increase, then it's a, you know, and it's $1. It's all, you see the total 61,000 that in some cases that covers one hospital visit, you know, so I think, I don't think there's a wrong answer here.
I think you make a good point with the sales tax holiday, because there were several people when that was going on, or not sales tax, I'm sorry, the premium amnesty period or holiday period. There were several people asking when that took place, does that mean our premiums are going to go up next year to cover for that? Again, it's a communication piece. I mean, people are there's going to be skeptics in every bunch, and we certainly don't want to feed that. But I think it's important for people to understand that it was good stewardship of resources that allowed for that. And, you know, I'm not opposed to a $1 increase that Caroline is in favor of. I don't think there's a wrong answer either.
Can I offer a substitute motion that we go with choice B?
I'll second that.
So now can we vote on the substitute motion? Now, David?
Or does the other person have to withdraw?
No, you vote on the substitute motion, and that should do it. Do a roll call vote on the substitute motion. It's the one on the table right now.
Okay.
And then you're done. Just do the roll call on that. And then if it's defeated, then you go back to the original motion.
Okay. Thank you.
Okay.
So Caroline Sidlow made a motion to approve choice B, a $1 raise on the medical employee portion premium across the board for 2021. Linda McGinnis seconded the motion, and we're going to do a roll call vote.
Okay, so Amanda Cox. Very best.
Aye.
Is that a yay?
Yes.
Yes. Okay. Caroline Sudlow made the motion.
Yeah.
Okay. Dwight Vanderbilt,
Aye.
J. Michael Becerra.
Nay.
Okay. Casey Stone. It's not here. Okay. Lisa Gerald.
Aye.
Linda McGinnis is an aye. Carter Pack.
Aye.
Michelle Carringer is not here. Nikki Davis,
Nay.
Randall Kenner,
Aye.
Samantha Chittum,
Yes.
and Betty Burkhart.
Aye.
Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9. So that's 9 yeses. And 1, 2, 3, 4 no's. Or not here to vote.
Did Amanda drop off the call? Because I didn't hear her vote.
I don't see her on here anymore.
Okay.
Yeah. Let me look.
So to pass, it needs to be more than half of members voting, right?
Yes.
Or present.
Yes, and there is more than half, 9, because there are 9 yeses.
So the motion passes to go with option B, right? Because we had enough.
Yes.
Okay. So David, I guess we just need to say now the motion passes for option B, the increase raised $1 per pay period for employees. 9 yes and 4 no.
What was the vote, Linda?
There were 9 yeses. Okay, then there are 2 people who are not here and 2 people who said no.
It passes because it's a majority of the whole board.
Yes.
Thank you.
Mhm.
So now to the next item on the agenda. Does anybody have any agenda items for the next meeting? Hopefully, if they get, one thing I would like to add, Stephanie, I know we had talked about this, if the new life insurance
Yeah, we should have.
Okay.
See, well, we may end up having it. It's probably going to go on September commission, so it won't be officially approved until October.
Okay.
I was hoping, I have a placeholder in August, but you know how these things go. I don't have confidence that it's going to be back in time. It may, but not 100%. Just waiting on negotiations of signatures before we can send it to commission.
Lisa?
I know that you're going to probably want to talk to us about open enrollment and maybe have the benefit guides. And we did talk about the life insurance, but if it's not completed yet, then we need to wait for another meeting. At our next meeting, I would like to talk about not meeting in October, November.
Stephanie, so to Lisa's point, when she just mentioned the open enrollment, do you think you would have that able to show us? I don't know. I feel like the committee might benefit by you showing us that step-by-step walkthrough, because I know that Munis upgraded and it's going to look a little bit different than in years past, because I'm sure we'll be the ones kind of helping our department show them how to walk them through. I know I'm going to have a ton of them to help. So, just to kind of, is that something you think you can have ready, even if you don't have your thing, but if you can show us on the screen, like how to walk through the step-by-step for next time?
Absolutely. Yeah, that'd be great. That's a good point. And if we actually have the life insurance, if it doesn't come back, I'm okay with you all meeting in October. I know Lisa is being really kind and trying to give us some reprieve during October when we're about to start. But without the help sessions occurring, we're okay. And so I'd be more than happy to meet with you all and go over life insurance in October if it doesn't end up getting on commission until the September agenda. So just something to think about. But if you want to skip November and December, then that works for me. That's usually when we're wrapping things up too, so. But I can definitely have the guide, Samantha, by then and go over it with you.
Okay, so it's going to be the open enrollment benefit guide for the September meeting.
I would say even if it's not the actual guide, if Stephanie can like walk us through employee self-service, like how people are going to sign themselves up, if that makes sense.
Okay,
Yeah, I would call it the employee self-service guide so they don't confuse it with the actual benefits guide.
okay.
Because we might not get those back till the 1st of October.
Stephanie, I meant to ask you, Krista had us sending items to her if we wanted a specific thing to talk about or whatever at a meeting. We still have the ability to add things to the agenda before it has to go to the newspaper. But what kind of timeline do you need before a meeting if there's information that a committee member wants to discuss? I know Krista had said at least 2 weeks lead time. And if it was something real involved, then it would probably take longer than that. But since you're new in the role, is that a 2-week period okay with you, or do you need more time than that?
No, I think that works. And if it's, not something that I have to rely on our vendors or our advisors or anybody to provide information, it could be less than that, but 2 weeks would be ideal so we can cover ground and make sure that we're giving everything that you all need. Okay. But yeah, that works for me. And my door's open if anybody has questions or needs anything in the meantime. I'm truly a public servant in that way for our employees. It's been one of the joys of being in the county, as all of my roles have been employee facing and employee support. So that's a major thing for me that I want to continue. And I think this committee has a good voice and a good representation across all of the departments. So
I have a question, Stephanie.
Yeah.
How difficult would it be for you to update us pretty much monthly at our meetings as to the status of our COVID claims, just so we can kind of keep an eye on it so we know what we're looking at for next year? I think most of us are going to be serving again next year, and so seeing what direction we may be going in as far as the potential for a significant increase in premiums next year.
I don't know if we'd have monthly updates. I would have to check with our data providers and see. There's typically a lag. So we'll see, claims come in for 6 months ago. But as I get updates, I am more than happy to share with the committee and go over any of those changes that we're seeing, if there are any, for sure.
Thank you.
So the deadline to add any items to the agenda for September would be August 28th. So if anybody has anything, they can email me by August 28th.
And Stephanie, if you don't have the life insurance stuff back by the next meeting, if that's the only thing that would make us meet in October, I'm fine not seeing it if other people are, unless there's some kind of drastic, terrible change, like the coverage is going to be worse, or, something like that. I don't know what the rest of the members, the committee thinks.
Yeah, it's actually going to be better, no matter who we go with. We've got a substantial savings to the county. We could always go over that later if we needed to, and kind of highlight it. But yeah, it's going to be a good thing. And I would definitely let you know if it wasn't, but all of the bids came back really competitive. It was actually hard to decide. Not really, because one was really good. And so we're hoping that it all works out. But the savings on the employer side, of course, is more because we have the basic and AD&D coverage that the county pays for, which is a substantial amount. But employees will see lower premiums across the board and may even have some higher amounts that they can elect. So it's going to be a good thing. So if you all don't need to review it or want to review it, I'm okay with that as well, but I can keep you updated.
Does anyone else have any questions? No.
I have one thing. Do y'all like this Zoom format?
I love it.
I do too.
I'm okay with it.
Rob's done a good job.
It's nice for those of us that don't work in the city county building too. I mean, I can always be there, but it's easier
Yeah.
remotely since I actually am not physically located in the city county building.
I'll have to call Amanda and find out what happened.
She was so worried about it. Goodness, bless her heart. Would anybody like to make a motion to adjourn?
I'll do it. Caroline.
Caroline. Okay,
I'll
Anybody want-
second that. Lisa Gerald.
Lisa.
You don't need a roll call vote on that one.
Thanks, David. Thanks, everybody. See you next time. We're done. It's 1:55 p.m.
Okay.
Thank you.
Thank you.
Bye, y'all.
See you.
Bye.